a 48-year-old female presents with chronic hand pain, tight skin over her fingers, and cold-induced color changes in her hands. I am showing you hand radiographs from two different patients. Please describe the findings.
The first radiograph demonstrates severe resorption of the distal phalangeal tufts, or acro-osteolysis, with tapering of the fingertip soft tissues. The second radiograph shows multiple amorphous subcutaneous calcifications in the fingertips, with bone resorption at the distal phalanx.
What is your primary diagnostic concern?
The combination of acro-osteolysis, fingertip soft tissue loss, and calcinosis cutis is highly characteristic of scleroderma, also known as progressive systemic sclerosis.
What is the earliest radiographic soft tissue change seen in the hands in scleroderma?
The earliest visible change is the resorption and tapering of the fingertip soft tissues, which typically precedes any bony resorption.
What is the clinical syndrome characterized by calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasias?
This is Crest syndrome, which is a limited cutaneous form of systemic sclerosis. Calcinosis cutis is the C in Crest.
Which other joints in the hand or wrist are occasionally involved by erosive disease in this condition?
Erosive disease can occasionally involve the interphalangeal joints, and classically, the first carpometacarpal joint, which can lead to radial subluxation of the metacarpal base.
What occupational or metabolic factors can cause a similar pattern of acro-osteolysis?
Occupational exposure to vinyl chloride and metabolic disorders like hyperparathyroidism can cause acro-osteolysis. Hyperparathyroidism is distinguished by subperiosteal bone resorption.
What other connective tissue disease overlaps with scleroderma and can present with similar hand findings?
Mixed connective tissue disease and dermatomyositis are key overlaps. Dermatomyositis typically shows more extensive, sheet-like subcutaneous and muscle calcifications.
Finally, what are your clinical management recommendations?
I recommend referral to a rheumatologist for systemic screening, particularly for pulmonary hypertension and interstitial lung disease. Hand therapy and medications for Raynaud's phenomenon are also indicated.